Hello, we are Table 1, and we will discuss why patient tested positive with genetic diseases should be mandated with genetic counseling. We will address a few key points. First, patient counseling on genetic diseases could facilitate patient understanding of the test results and disease management that a general practitioner may not understand or have sufficient time to address. In particular, a patient with limited health literacy may benefit with additional discussion with a counselor. For example, in a German study of patient and professional attitudes about genomic testing, about 40% of patients admitted they did not completely understand the scope and consequences of genomic testing. It is particularly important for the patient to clearly understand the genomic test results, so they will share this information with different providers in the future that may be prescribing medications to avoid redundant testing and inform therapeutic decision-making without delay. Genetic counselors may also discuss the implication of genomic test results for other family members. Our second point is that the patient may not have the resources readily available to them to be able to look up information on their newly diagnosed disease state. Because many of these diseases are rare, so there isn't as much information available to the patient. Because of this, the pharmacist or healthcare provider that diagnosed the patient with the genetic disease should be mandated to counsel them about their condition and provide them with the reliable information so the patient is able to make the best decision for themselves. Our third point is that genetic diseases not only affect the patient, but will also affect the future generations of the patients as well. Lack of counseling and awareness of the genetic disease may cause increased costs to the healthcare system for this specific patient as well as the patient's children and grandchildren. If the patient has increased awareness of their condition, they will be better able to manage their disease state, which will also decrease the costs. Genomic-informed therapeutic decisions may result in reduced patient burden and costs associated with trial and error of medication for the treatment and follow-up care required for the management of the adverse effects. The reduced burden and cost of the patient could positively influence medication adherence and thereby improve long-term outcomes and health costs. The last point we'll mention is that if the patient has a genetic disease, then there is a risk for future descendants to be born with the disease. Patients should be aware of the likelihood of this happening as well as the associated risk so that they can make more informed decisions about having biological children or possibly looking into adoption. Therefore, the benefit of the patient and the patient's descendants, counseling on newly genetic diagnosed diseases should be mandated.